So today we're going to talk about the treatment of the lower face in cosmetic medicine. This is for the benefit of my patient who always ask and query about, well, what other treatments can be done. So a lot of people come to me and they ask for the three areas. This is the standard of anti-wrinkle injections for the three areas. So that means the frown, the forehead and around the eyes. But many people are forgetting about the lower face, and we see a lot of people coming in now where the upper face is very well treated but the lower face is undertreated, and this is a pity because we need to treat the lower face well. We can't let the lower face be aged and the upper face looking young. So the thing about it is that the treatment of the lower face isn't as dramatic for the patient. So when the patient gets the upper face done, they get the frown, they get around the eyes, and they really see the results. The lower face is more of a subtle result and it's more preventative. So people are kind of slower to see the benefit of treating the lower face, but over time, if we don't treat the lower face, it's going to become noticeable that the things are sagging. So when we look at the lower face, we say, well, what's the main aging factor in the lower face? In my opinion, that is overactivity of the muscle, the platysmal muscle in particular, but also the DAO and the mentalis, but particularly the platysmal muscle. So the platysmal muscle is unusual in that it is a muscle that gets stronger as we age. So most muscles get weaker, but the platysmal muscle unfortunately gets stronger. So it's a muscle that attaches into the lower face, and it goes down across the jawline, this area here, down onto the neck and inserts into the upper chest. We see a lot of people where that gets stronger with time, where it's overactive, and basically it's dragging the face down. It's causing jowling here, it's causing marionette lines here, it's causing blunting of the jawline, it's also causing lines and bands on the neck, which become more and more visible as time passes. And the interesting thing about this is that this muscle can often be overactive in the 20s, when a person's in their 20s, and it's getting stronger and stronger. So it is something that does need to be treated. I think that's the cornerstone of treatment for the lower face aging. So I think treatments with Botox or similar products have a great benefit in that regard. And if you get in early and you do it twice a year, then it really does slow the aging process. The skin on the neck is better, the jawline is sharper, the marionettes are less likely to occur, jowling is less likely to occur. So that's the key thing to do. And if you do it twice a year, you will get the benefits. Now, what other factors can contribute towards aging of the lower face? Well, definitely I think people lose volume in the lateral face. You'll often see people that lose volume in the lateral face out here, which leads to a descent of the tissues. So sometimes we revolumize there. We have products where we can revolumize there. And then the other things, so that can be hyaluronic acid. So a hyaluronic acid with a good G prime to lift that area and to revolumize it, and that can really help. The other thing that we can do, of course, nowadays are biostimulators like Sculptra. So Sculptra is very good in that it's a biostimulator. It stimulates a lot of collagen production. Best area for Sculptra, in my opinion, is to use it out this direction and on up, even into the temple. You have to be very careful with injection Sculptra, but it does give a nice lift. So if you combine that, then also your anti-wrinkle injections, your neuromodulators to treat the platysma that we just spoke about, that will give a nice lift. Sometimes we see jowling, and we do fat dissolving injections into the gel, which does help somewhat as well. Then we have to think about, well, are there any devices that can maybe even tighten the skin in that area? Well, we do use the Cyton, the skin tight mode on the Cyton laser here, which is very good at tightening the skin in that area. So that's an added benefit. But as I always say, combinations are key when it comes to anti-aging procedures. So we do need to combine these things, say that cornerstone has to be the Botox, the neuromodulators in that area, then you're revolumizing, then you also can revolumize around the mouth, treat any marionette line that is there, and Restylane have very good products for treating that area. We can then look at the skin and say, well, what resurfacing treatments we can do. We can look at applications of retinols and tretinoin, which is another good product. We can use peels. We can use Cyton Pro-Fractional, which is a fractional laser that definitely treats the skin quality in the area. We can also combine then with skin boosters in that area, and Profilo is a good option, as are Restylane skin boosters. So sometimes we even go subcutaneous with a biostimulator like Radiesse under the skin and neck. We have to be super careful in the treatment of injectables in the neck, because we know that there are very important structures just under the skin, like the carotid artery. So that's only millimeters under the skin. So we have to be super careful in that area. You really need to know your anatomy when you're injecting in that area. So they're the important things that we do. So there's no point in having the upper face looking great and then not treating the lower face. So if we recap on that, we've got your Botox treatments of the platysmal muscle, we've got your volumizers, we've got the biostimulators to lift, we've got the Cyton skin tight device to tighten the skin, we've got the skin boosters like our Profilo, like our Restylane skin boosters for the skin quality of the neck. We can combine that then with the Cyton Pro-Fractional treatment, and then we can think of dilute Radiesse under the skin in the neck area. It can definitely lead to collagen production in that area. And then some people say, well, like things have gone too far and they may look to have surgery done. And this is an interesting point actually that we discussed with a colleague in France. He's done 3,000 facelifts. But what he finds is that if he does the facelift and then again that platysmal muscle isn't treated afterwards, within a couple of years, the muscle will actually pull the facelift down, will pull the neck lift down, and the person is back to square one. So now what he's saying to his patients is, okay, we'll do the facelift, but only on the understanding that we have to treat the platysma every 6 months to keep it under control. And in that way, then the facelifts last longer, the neck lifts last longer. If you get in early and you treat the platysma twice a year, you won't hopefully need a facelift, you won't need a neck lift, because you will protect your neck from that descent. I think that combination is a good combination, and that will prevent the need for surgery. So I think it's important, because people often ask me this, and to get the time to go through it is difficult, and it does take time to explain that. And then they want to think about it. They really, because they don't see the big benefit like they see with the frown, with the lines around the eyes. They don't see that immediate benefit. It's more preventative over time. So I think people have to understand that concept. But if they stick with it and they do that twice a year, they will see major benefits in the long term. I think I've summed it up fairly well there today in the video. Have a think about that, because there's no point just to leave that area untreated and treat other areas. And thanks.